Hi, Lisa White, IVF coach with IVF Manifesting a Miracle, here with Dr. Greene for another clinical conversation. How's it going?
Hey, how you doing?
I'm doing well. How are you?
Excellent. Thanks for asking.
Yeah, today's topic is all about shared risk, the pros and cons of IVF refund programs. So this is new to me. I didn't know much about that these even existed. And I'm hoping you can define like what an IVF refund program is.
Well, yeah, and in fact, first, just a little bit of historic perspective. I actually, at earlier point in my career, I worked for the guy that first came out with, quote, the first pregnancy guarantee. A gentleman by the name of Dr. Jeff Shear. And basically, he started offering people way back in the 1990s a money-back guarantee if people didn't get pregnant after they completed a certain number of treatment cycles. And at the time, this was considered very ethically dubious. Keep in mind, nowhere else in healthcare is there a guarantee. No one guarantees you'll survive your appendectomy or that you're not going to get a hospital infection. There are no guarantees in medicine.
Yeah.
And this was like the first efforts to ever achieve something like that in the medical field, which created, quite a bit of backlash. And there was a tremendous debate, back and forth within, the reproductive community as whether or not this was appropriate. Ultimately, the American Society for Reproductive Medicine, which is the governing body that any ethically reasonable healthcare provider in the United States has to answer to this governing body. And they sort of set the guidelines, and they stepped in many years ago and said, okay, time out, we need to review this. And they reviewed this process, and they, over the years, they have continued to grow and evolve and develop into what is today often called a shared risk program instead of a pregnancy guarantee. And the idea of a shared risk program is that fertility centers that feel very confident in their ability to deliver the highest level of success acknowledge that it sometimes does take more than one try. And so, patients can be offered a prepayment of more than it costs to try once, but be given it like sort of a ticket to try a certain number of times. And typically it's like 3 tries. And then if they're not pregnant by the end of their 3rd try, they get a certain refund. It's either some or all of what they originally paid, depending on the agreement. So it's a shared risk, in the sense that the patient is risking upfront that they're overpaying because they're paying for more than one cycle. And the center is risking that they're going to lose money because if they have to do more than one cycle, then they might end up losing money, because it costs us a certain amount of money to do an IVF cycle. So if someone has to have a 3rd cycle, for instance, then that basically costs the fertility center. So that's why today it's called a shared risk program. Okay.
And it's like people are offered the possibility of a full or a partial refund.
Exactly. And like any insurance or contract, people need to look at the details because not every shared risk program is equal. And that's part of why the American Society for Reproductive Medicine continues to monitor and regulate and update their recommendations. And in fact, here's they just recently updated the guidelines, and what they call this is refund programs is sort of their guidelines. And again, they describe this as, quote, financial risk sharing, where patients are agreeing to a higher initial fee for a package of multiple cycles, which are discounted over the one cycle fee.
Yeah, so you're paying more than what you would pay for an individual cycle.
Exactly. And that's one of the things that it's very important people need to understand is that if they get pregnant on their very first IVF cycle, then they paid more than they would have if they didn't have that guarantee.
Right.
But in some ways, it's like other insurance. We often pay, auto insurance, and that doesn't mean that we intend to get in an accident. Hopefully we
Mhm.
never actually have to activate that.
Right.
That's a different type of a shared risk.
Seems like there's a lot of details that would go into it, like how many egg retrievals. I mean, is it a total package? I guess you could
Exactly, and these are the exact details that are outlined, and each center is different in terms of the shared risk programs that they're typically offering. But the American Society for Reproductive Medicine has stated some very explicit guidelines. Number one, it should be clear to the patient that they're paying more for the first attempt than they would otherwise be paying if they didn't have the shared risk program.
Okay.
Number two, people have to explain to the patients what they need to do in order to qualify for a shared risk program. Because, if a patient, comes to a center and has a very low chance of success, they probably are not a candidate for a shared risk program. And this is problematic because some people get lured to a certain center because they know that center offers a shared risk program, but they might not offer it to the person that got lured to that center.
Yeah, it could be your age, right? You got to be maybe a certain
It could be age. It could have to do with the number of previous attempts that people have had. It could have to do with some of the baseline testing, and so, it has to be outlined at the beginning of what people need to do to qualify. Another important, item that's outlined in the recent guideline is it needs to be outlined to the person exactly what they need to do to earn the refund and how much of a refund it's going to be.
Wow.
Some centers will refund everything that was paid up front. Some people or some centers will offer a certain amount back. But the reason it's considered ethically appropriate is the intention is that the money that comes back is to provide people with the opportunity to pursue other options like adoption or things of that nature. And it's intended as a goodwill gesture to say, well, we tried our best and it didn't work, and here's what you get in return. And the bottom line is like anything related to contracts or insurance, the devil is in the details, and each shared risk program is a bit different from the next one. And it's why the terminology that's used to initially spark interest needs to be outlined in detail.
Thanks for sharing all this. And so if people have insurance, they're not really a candidate for this kind of program, but maybe if they're cash-based, they would.
Exactly. And in fact, most people that have health insurance that covers fertility are not eligible for a shared risk because their health insurance would supersede and exclude them from those sorts of prearrangements. So, that's one of the reasons that states like ours, as you and I talk about frequently, Lisa, are looking to try to expand, the availability of fertility coverage through people's primary health insurance. And this is something that's really offered more to people that, as you mentioned, don't have insurance coverage and are just looking to optimize their chances that one way or another they're going to have the ability to have a child.
Gosh, I can't imagine. I mean, one round of IVF we know is very expensive. I can't imagine people paying upfront for 3 to 6 rounds, possibly. Could be in a shared.
Well, I was going to say 6 would be unusual. Most of the shared risk programs that I'm familiar with, are up to 2 to 3 IVF cycles.
Okay.
But what it'll often include also is transferring all of the embryos. Meaning, like, for instance, if somebody goes through one IVF cycle and, for instance, produces 6 embryos, that could be, 3 to 6 transfers, depending if someone's putting in 1 or 2 at a time before they could even try their second IVF attempt.
So if someone gets pregnant on their first go round, they're kind of out after that, like with the shared risk program, like it worked for them. So they've already paid up front and
Yeah, most, like I said,
yeah.
the vast majority of shared risk programs, the outcome is one successful pregnancy. And so like, for people that want to have 2 or 3 children, this does not necessarily, put them at any greater position for their next pregnancy unless they wind up having extra embryos that they could come back and use that are in cryo storage.
Wow. Thanks for shedding light on this. I didn't know about
Absolutely.
programs.
Well, and again, it is such a complicated thing, and it's so complicated to explain in writing that sometimes it's easier to talk some of these things through. And bottom line is it's good to have options. I think it's great to have this to offer to people that want it. And in the vast majority of situations, I actually try to talk most patients out of doing it because, I want my patients to be excited. And I don't want them to feel that they've overpaid. And if a center is really good, then chances are people are going to be successful after their first IVF attempt. And, better off that they have that extra money available to take care of their child.
Right. I appreciate you sharing your personal opinion on this.
Yeah. Well, you know me, I'm pretty outspoken.
Yeah, you're honest and forthcoming. I appreciate that about you and love doing these clinical conversations with you. So thank you.
Absolutely.
Yeah. And for anyone else who wants to hear more of our videos, you can visit my website, ivfmanifestingamiracle.com, and the YouTube channel, Lisa White, IVF Manifesting a Miracle. And you are at enhancingfertility.com, where you have blogs and information, and we'll continue doing more of these talks. So
absolutely.
Thanks so much.
Stay happy.
Bye-bye.